Hi, I'm Dr.Akshat Pandey. I'm a practicing rheumatologist from Indore. Today, I'm delighted to have with me Professor Ramnath Misra, who is among the senior most rheumatologists of India from SDPGI Lucknow. We welcome you to IRACON-TV, sir. How are you today?
Thank you. It's been a great time we've had for the last 4 days. I'm counting the 2 days of musculoskeletal ultrasound.
So,
It becomes quite exhaustive. This
of course.
very beautifully detailed conference.
So, how was your overall experience in IRACON 2023, and what thing fascinates you the most personally amongst the scientific program?
First, I would like to compare how things have changed. I did one in SGPGI Lucknow in 1999. So let's say 23 years. You'll probably be like to know what was then and what is now, what is the change. There it was a one-room activity, 30 to 40 people sitting around, and it will be an intensive program of 2.5 days. There would be a half a day CME, and in that everything was covered, including the CPC and of course the talks and all. But there has been a sea change. Number of trainees are more, number of training institutes are more, number of practicing rheumatologists are more. And it becomes a very complex activity to organize a academic meet to cater to everyone's need. The biggest challenge is for people like me is that if parallel activities are occurring in 3 rooms with so many themes, talks, topics, you tend to miss out on some activities because you are at the other. But the real question I often try to ask myself is there a way out? Can this be a way out? I think we have to realize that emphasis has to be given to younger and mid-generation. Now that I'm a classified, not young, not old, and original work, people who are doing some activity, that has to be a center stage, because our thoughts, our hopes are with what is being done by investigators across the country, and we could minimize on talks. It is just my suggestion that let's say oral presentation or posters given a center stage and talks are reduced to minimum, and workshops are done for clinical case challenges. Real case, they have been challenging, and experts or veterans senior ones can be given a slot like, where did I miss or what mistake I did? Some reorientation probably would, there has to be a change, because you probably is aware the rheumatology is no longer just a clinical science.
Of course.
It is changing with the advances in technology, both in imaging, in molecular biology, in immunology. Many of these drugs, they are based on targeted sites. So, little lecture on immunology
Yeah.
would probably help molecular biology, drug discovery technique. Well, we are going to, can't help it.
That's a wonderful sessions, sir. I'm sure the people will incorporate them. Sir, you gave a workshop on musculoskeletal ultrasound. So I would like to ask you a question. In what's the future of musculoskeletal ultrasound in India? And also, being a private practitioner, if one has an interest in musculoskeletal ultrasound, it's very difficult for them to do ultrasound in their private practice. So how do you? What's your take on that? Like, what do you suggest for a private practitioner? How we should be like? So often,
Look, I'm a trainer, I'm a teacher.
Yeah.
I don't see, my job is to, if there is a technology,
Ji.
be it immunology, be it ultrasound, my role is to introduce to our rheumatology colleagues the technology. Now, I introduced this in 2006, the first ultrasound workshop. And I have been doing it regularly. First, I did it in SGPGI. Then I have been doing in IRA or APLAR in 2005. And I always feel a rheumatologist forgets his anatomy largely by the time we are actually practicing. So you can see what is the problem. If you ask me as a rheumatologist, what are the compartment of the wrist? I can only see a swollen hand and a pain. But ultrasound gives a wonderful stethoscope-like aid to visualize what the ulnar artery looks like, what is the, and certain areas we do inject blindly, like a shoulder, a frozen shoulder has come, and there is a bicipital tendon rupture. How the hell would you know that there is a rupture unless you do an ultrasound? And if you see an ultrasound, you would not inject, you would approve. So also ankle joint swelling. It's very difficult sometimes to ask the patient to open the shoe, where is the edema? And when you look at the edema, you sometimes see God only knows what is inside. So MRI is expensive. Ultrasound is dynamic. Why not teach it? Now the question comes, rheumatologists have a problem, they are not registered user of it. But who is asking you to give a certificate? You just ask with your management to give a stethoscope in a form of ultrasound. You look at yourself, and as it is inducted, we will try to induct it in the syllabus.
Wonderful, sir. So, any concluding remarks to your students and young rheumatologists?
I have one instruction to them. To the student of rheumatology, identify your area of interest. Identify one problem. If you are interested in neck pain, spend 10 years in neck pain. Then only you can be useful. If you want to see that, rheumatoid, SLE, amyloid, then it will be too much for you.
Yeah.
Be focused, and pick up. For example, I would like the young generation to work on geriatric rheumatology, problem of a geriatric population. Look at those who are specially handicapped. Look at children with rheumatic disease. all can do, but get yourself focused. Unless if you are not focused now, in after 5 years, you would find it difficult to master all. You will never become. You try now, and 20 years later, you will contribute something because you will be passionate about your interest.
Wow. So that's some eye-opening talk by Professor Ramnath Mishra. Sir, we are really glad to have you here today. And
Me too.
so thank you. And we wish you best.
We've never been kind of
Yeah.
this kind of.
So this is our first time we introduced this IRACON-TV sort of thing. So how was your experience? I have not asked. I have taken so many interviews today, but I have not asked anybody how's the experience about the IRACON-TV thing. So could you throw some?
Well, I think it's a wonderful platform, and it is better you don't ask structured questions.
Yeah.
So that
Absolutely.
you ask people on their own
Yeah.
what they feel like, what the challenges.
Yeah.
It will certainly be more lively, more dynamic.
Yeah. Thank you so much for coming. Thank you.